Hi, everyone. Thank you to
Hello.
Emily. Hi. Thank you to Emily, who has hit the record button for us. So this will be recorded. Good to see all of you. We do have a series of questions, but before we get involved in that, is there any comments or I have questions for you to engage in our discussion, but there's any clarifying questions for the team just on this process or questions from what we've already talked about just previously to breaking out into groups? No? Okay. Emily is going to be Jamboarding for us. We will have the blue sticky notes. Try to be as organized as we can. I do want to make sure that you know, EMAC members, that Jennifer Raby from the project team is here, and hopefully if you have questions, technical questions, she can help answer them. And we also have Rebecca Steiner, who is new to our team, so is listening in. So welcome. All righty, well, we'll go ahead and get started. So the first question is really about that research document. And what did you notice about that in your reading of it? And is there any examples or of any of the findings that you think are particularly useful?
I thought it was something that stood out to me was what they did in LA and the amount of revenue that they allocated to funding some of the projects. You're using 40% to fund that I-10 Active Commute Healthy Communities project. I thought that was kind of interesting. It's a really large amount that they committed themselves to. And trying to look over the results of what those outcomes were, but it was nice to see that they've dedicated such a huge amount from those from the revenue.
Thanks for that. Any other reactions or just things that you really liked or because you thought they'd be really relevant to today's conversation?
One of the things that stood out to me was how clearly you can tie the health impacts to the reduced congestion. And since we're looking at tolling sort of as two purposes, one is to reduce congestion and the other is to raise revenue to do some of these expansions and mitigations. It seemed to resonate that improving the congestion really does benefit underserved communities who have been impacted from a health perspective.
Thank you for that. Bill, did I see your hand up?
You did, very briefly. I agree with what Sharon had to say. I was thinking more of along the lines of just the impacts of air quality, and as this being a place where summer becomes more about air quality each year, just noticing and taking into account how having vehicles idling next to people's houses is going to cause adverse health outcomes. So just echoing what Sharon said.
Okay, great.
Yeah, this is Phil, and I think the thing that I was really impressed with is, and it's in that slide deck, that logic model. I believe it was from San Francisco. And I think what's really powerful about that is that it demonstrates the importance of taking a very holistic view of health and how so many elements of what we're talking about that otherwise could fall into very precise silos, that each one of those specific details actually, from a very holistic perspective, have major contributions and major impacts on health overall. But you wouldn't necessarily see that until you see this laid out in this kind of logic sequence. You start with a policy or whatever, and then it carries through all the way to the ultimate health impact. And I think that's the power of this kind of a logic model, which is really what an HIA or health impact assessment is intended to do. So I think it's fantastic that we are essentially bringing that into this conversation.
Phil, let me take that a little further, because I know you've been an advocate along with Abe Mullen for a while about HIAs, and Sharon, you brought up just brought up as well. Is there anything you want to do with that? I mean, in terms of, I'm looking ahead to where you're going to get as a committee, and this is really the time, in these breakout sessions to do some brainstorming, to get something down on a piece of paper. And I'd love to do that. If you see there's, some sort of strategy or something and some clarity that you want to bring around to that, and let's talk around as a group, like rather, in addition to just saying, this is a great idea, is there a great idea that you want to move in, move further? And I don't want to push you further than you want, but at the same time, I don't want to leave an opportunity.
Well, I think when Abe and I first, sort of brought in the whole concept of an HIA, what it was intended to do, at least at the beginning, was to make the argument about health impacts extraordinarily powerful. And you lose that power if you talk about very specific things like, okay, so congestion causes air pollution. Something else causes noise. And if you just take any one of those individual items, in and of itself, they may seem relatively small, or at least small, like a single small item in many items. But if you think about it more from the holistic perspective of how this contributes to overall health and how there are cross linkages. So in other words, it's not just point A to point B, it's point A to A, B, C, D, E. So in other words, there are many multiple impacts and they all cross link. And I think that lends an awful lot of power to the ultimate goal of we want to improve health.
Thank you. Is there any other reactions there? Because I think we're going to have to move on to question 2. And any other thoughts from other folks in the group?
My only additional thought is I don't know how best to design a health impact analysis that we would, include going over and above the NEPA analysis. I just don't have the tools in my toolkit to know what that should look like. Is that what you're asking for us to do, or is it just good enough to say we want to have a health impact analysis as part of this process without specifying what that looks like?
Well, I'll address that. I think we can say that as one thing, but there are resources in our community. And in fact, Abe and I had some conversations with a couple of folks, both at Multnomah County Public Health and at OHA, Oregon Health Authority, who are in fact specialists in health impact assessments. And so if we choose to take this to a more robust level, we have the resources to be able to do that. On the other hand, if we simply want to say, we think an approach like an HIA is very important to do, and here's the reason why, I think that's also appropriate. I think it just depends on how far we want to go.
Amanda, can I bring you in here?
Yeah, I was just going to echo what Dr. Wu said. I think an HIA can reveal how the community is thinking about health as well, because that's part of the process to reach out to a variety of stakeholders. But I think anything that can help us get at the other aspects of health beyond air quality, which is it's big and it's measurable. So that's all good. But there are all these other pieces around livability and, you know, beyond the standards of air quality and access to care and noise. So I think the safety of having increased traffic, I think the livability, the mental health components of that, all of that we know disparately impacts communities of color. And so to me, I think this is an opportunity, either an actual HIA or a process like an HIA would highlight those things that do go, I think, beyond the NEPA process from what I can tell.
So I'm being told we're about time to move on to the next one. Can I say here that, you know, just in terms of this group, so our small breakout group here, that there's general support for doing an HIA or that type of a process as part of this effort. I'm seeing that in Bill and Sharon's doing that. Izzy, how are you feeling about that? Yeah. Okay, great. And then Emily, you got that down? Okay. I think she's figuring that out in our Jamboards. Okay. Thank you. Okay, moving on to our, you know, bigger question where I have a little more time. Just the draft, or, you know, the ideas for policy and strategy recommendations, and some of the things that were provided to you were really based on what this committee has said in the past, either in our meetings or in breakout sessions or in one-on-one conversations. You know, you have the question there, sort of the overall one of, you know, are these the policy or strategy options that should be advanced for further considerations? And I guess I would just reword that of, you know, what are those your general reactions to these ideas that were in the draft? And there was there were some related to policy, some related to strategies. We're not going to get too worried about whether it's a policy or strategy. We just want to get good ideas down on paper. And if anyone needs to sort of a reminder, I can go over that. Hopefully you kind of have it available to you.
Can you point us to which page it is in the
sure
many hundred pages?
Yes, I am sorry. It is the one that it's the one that's titled EMAC Policy and Strategy Options. Oh, and Bill has sent the link. Thank you very much.
I had to look it up too.
Yeah, and it's really page 2 and on to page 3. So the first one was a potential idea of toll revenue dedication and dedication of some amount or percentage of revenue to address impacts from diversion, or to dedicated to community-based organizations to invest in programs. So that one was the toll revenue dedication. And then there was another one related to toll exemptions, discounts, and credits focused on health-related services. And then the other policy option idea was dedication of or definition of the corridor for investment. Bill, any thoughts there?
Yeah, in regards to toll exemptions, discounts, credits, rebates, the second bullet, NEMT, non-emergency medical transportation, I feel that volunteer driver programs need to be added to that because they serve a very similar purpose, getting people to their health destinations, and they're doing it at the lowest cost option available, which is a volunteer. And so we don't want to be penalizing these programs, penalizing people volunteering their time. So we need to make it as attractive for them as possible. And if there's a way to use this as, hey, you get a toll exemption, maybe there's a way to funnel more people into being a volunteer driver. So maybe there's sort of a carrot as well.
Yeah, and tagging onto that, Bill, I think we also might want to make sure that we're pretty inclusive in volunteer drivers. That could include like Meals on Wheels, those kind of grocery services that some seniors get. So
yeah, I really like the Meals on Wheels idea. I'm the for-profit sort of like grocery store delivery. I don't know if that falls into it, but I think if you can make a strong argument that it ties to a social service, I think that's worth pursuing.
Yeah, I think that there are some or grocery services that are free for seniors that are similar to the Meals on Wheels programs.
And before we lose this, I just want to say both states as well, because being in Vancouver and operating a volunteer driver program, we have people who come into Portland and take folks to OHSU, for example. And so that's really going to impact our ability to get people to where they need to go if we're now having to pay tolls for those trips.
So just before I see Phil, your hand, but before I leave this, is there a general thought that this policy option idea of toll exemptions, discounts, and credits for non-emergency medical transportation, what I'm hearing is that there's support for that, but it should also bring in volunteer drivers. Okay, Phil.
And social service delivery.
And social service delivery.
Yep.
Thank you, Phil.
Yeah, and you know, on the policy option about toll revenue dedication, I mean, I think that's, you know, extraordinarily important. I'm looking at the slide, and so you know, which just basically has, I guess, a high level description of that. But I think it's very important for that toll revenue dedication to be very specific in terms of identifying either specific dollar amounts if possible, or specific percentages. And I think, as we've discussed before, it's important to identify or to state whether you know, these percentages are from you know, gross revenues or from net revenues, because there will be a significant difference there. And then finally, on the point about addressing impacts from diversion, you know, I would like around some specificity, something like, you know, addressing impacts from diversion by enhancing multimodal transportation. So in other words, impacts from diversion could mean almost anything, I think. But I think what really is going to be important for you know, EMAC communities will be having alternate modes of transportation. So supporting active transportation, public transit, and all those other various aspects.
I did wonder about that because we did, and I wanted to just explore this a little bit more. Dedication of toll revenue to support historically excluded and underrepresented folks was something we talked about in the transit and multimodal discussion, and it's coming up here again. And then there's also, I'm sure it'll come up again in terms of transportation affordability and how are we supporting people who are experiencing low incomes. So, you know, teasing that out of toll revenue dedication and who benefits from that. So, you know, you might want to just think about that in terms of, is it really to address impacts from diversion, or is it to enhance transit, or how do you message that in terms of your recommendation? Do you prioritize?
I'm not sure I quite understand.
So we, in the I think one of your recommendations is to dedicate some percentage of toll revenue, some portion of toll revenues, to enhance transit and multimodal.
Right.
Do you also want to recommend that some of the toll revenue be used to address impacts from diversion that's separate from transit, or is that just a combination with transit and multimodal?
Well, I guess it could be a combination, but I maybe what this means is being specific about what those other impacts of diversion are. That would be separate from supporting other forms of transportation.
Thank you. Any other thoughts on the toll revenue dedication ones, or the toll exemption discounts and credits or rebates? Any other thoughts? Another one of the suggested ideas was that came out of a lot of conversations here was definition of the corridor for investment. And what's come out in conversations is just a balanced approach of focusing on highway and areas further from the highway that will be affected is needed. Consider a wider area of impact to include rural areas where equity framework identify communities live and is not limited to the distance from the highway. Is that a policy option that this group could support? Yes. Okay.
Yep.
Great.
And I think that that's important because previously, I think we were led to believe that the definition of a corridor was really very restricted, to almost a small distance away from the highway, and that sort of demarcated distance wasn't enough to include the actual communities and how they would be impacted.
Yeah, I do remember that. Jennifer, Rabi, is there any clarification in terms of that just in terms of NEPA mitigation that might be helpful here?
For the definition of the corridor?
Mm-hmm.
No, I mean, I think there has to be a direct linkage, like the corridor can't be the entire metro region. We need to be able to tie, to tie the impacts to that. It can't just be a giant wish list, but if you can make the direct linkage to where there are impacts, then it makes sense. I'm not exactly sure what that process for defining the corridor will end up looking like. I think that's something that this group can influence, but ultimately it's the OTC that's going to make that determination, right, Anne?
I'm not sure.
I think so.
I know this group can make a recommendation though, which is
right.
Thank you.
Sure.
Phil, did you have a comment? I just see your hands up, or is it just still up? Amanda.
Yeah, I have a couple of questions. I'm just trying to wrap my head around some of this. So some of the conversations at my agency are around the toll revenue and what that can be spent on. And so I'm a little, I don't know that making it really specific will help us in this instance if it isn't something we can do. So I'm just curious because I don't totally understand the conversation, especially with the recent conversation in the legislature. So I'm just trying to understand what is the flexibility, and I don't know if that's I don't know if that's an ODOT conversation or where that conversation lives. So I'm trying to figure out this balance between providing enough guidance to make sure that we're addressing equity, but not tying our hands in a way that negates the ability to do anything meaningful.
Mm-hmm. Any other thoughts there? Other folks have been struggling with that as well.
I'll just jump in. I think
Sure.
It is a very complicated question. And even though we've been at the OTC briefed on the limitations, I couldn't explain them to you in a way that I would be comfortable. I do know from talking to the folks in the Urban Mobility Office that there is an appetite to push the envelope, so to speak. And, when it comes to mitigation, I think we have some opportunities to broaden how we look at things. But we're also constrained by the Federal Highway Administration and Oregon Constitution. And so I think it might be useful to have some briefing to this group about some of those bookends before we get further down the road and say we want to, recommending this and this, and then be told, well, that's beyond what we can do. So I think it's a very challenging question. I think if this committee makes recommendations that are general in nature, saying we want to make sure we're providing mitigation for diversion, including impacts to disadvantaged communities and transit and multimodal, I think that would be good. So it's not too specific, but covers all our bases. I don't know if that's helpful or not.
Is that helpful, Amanda?
Yeah, that's helpful to me. Thank you.
Okay. I think this is a question for sure. They're getting lots of notes here. Looking at the strategy options, which there was a couple of them, ideas that came from this, group. One was address historic disinvestment in communities adjacent to the highways that will be impacted by diversion to improve air quality and health through design elements or investments. And then there was those 4 elements that Garrett talked about: the access to human needs, to promote neighborhood livability, to enhance safety by preventing injuries and fatalities, and then enhancing environmental quality. So that was one strategy option, and address historic disinvestment in communities adjacent to the highways that will be impacted by diversion to improve air quality and health through design elements or investments. So the second one that was an idea was improve community health through the implementation of the toll system. And then there was a couple of bullets under there. Are these 2 strategy options ones that are heading in the right direction? Are there edits that you think are needed? And is there anything missing?
So under access to human needs, it might be, I guess it's covered in livability, but it seems like those are the very basic things that people need to live, but not really so much to thrive or be happy in their life. But as I'm reading further, I think that's a little bit covered in livability.
Okay,
So I spoke before I read.
that's okay. So breakout sessions are for. Other reactions to these ideas?
One, it's not a concern, but more a comment on the improved community health through the implementation of the toll system. Is around, again, diversion and folks driving on residential streets, and infrastructure that does or doesn't exist might put people at risk. So you might gain from air quality and noise and recreation and access to healthcare facilities, but if the infrastructure currently in place on those corridors is lacking or non-existent, we'll be putting people at increased risk of being involved with a crash or fatality or serious injury on the road from getting around. So just something to flag.
Is there a way that we could fix that to, fix that gap? Just in terms of the language, or adding another idea?
Actually, now that I'm reading, I'm scrolling up. I do see a safety component under the addressing historical disinvestments. So I think that kind of covers it. So never mind, I take that back.
Okay. I just wanted to know if we needed to be a little more specific anywhere.
No, I think we're good. Thanks.
So one of the things that it's neighborhood health and safety is a broader term that we're looking at health. Through earlier processes, we've heard a lot about and concern about diversion. Are these ideas for strategy options or policies, are they enough? Do you think we get at that concern? Because I know I read a lot of comments that have come through, and there's a big, especially in our local governments, are definitely concerned about diversion and the effects to communities.
Well, I think one of the concerns is what comes first, and then the impacts of what comes first. So if tolls are implemented before any of these improvements are in place, then that's going to be quite detrimental to communities that are experiencing diversion. But if we're able to strengthen those communities beforehand, so the impacts of tolling and therefore diversion is reduced, I think it's going to be a lot easier and safer for those communities. But when you're tolling to generate revenue to complete these projects, it sort of seems like a chicken and the egg situation.
Mhm. Any thoughts on what Bill's saying? And I think that's consistent with some of the things I've heard that have gone on. Just some of these improvements need to be made before the toll system is enacted.
It's a little challenging because some of these things are going to cost money to do.
Mhm.
And so there may be a time lag because we can't spend the money unless we have the money. I mean, you can, bond and borrow and things like that, but I don't know that there's going to be any guarantee that all the mitigation will be in place before tolls happen. But we should be able to structure the plan so that there is assurances that it will happen in good order. So, it's one of those, it's a chicken and egg problem.
Mhm.
Yeah, I think being able to provide that assurance by one method or another, tied to, again, that notion of being able to be transparent around a percentage of revenue that will go to that. So in other words, you say, we assure that this will happen, and we are dedicating X percentage of dollars to that, I think can at least go a long way in sort of lessening that problem right at the very beginning.
Okay, thank you. Anything else? Is there anything else that we want to add to this in terms of ideas?
This may be a little out in left field, but one of the things that we were talking about in the scuba team, Bill, and I think you may remember this. I think we brought up the question about what happens if you have freight being diverted. I think we've always talked about diversion, sort of generally thinking about cars and what that does to local neighborhoods and communities and all that kind of business. But what's the chance that you would actually have trucks and freight diverting? And that might look a little different.
It's
I think that's
documented.
a good point and just something that needs to be captured. I think diversion is, with cars and freight, are two very different things and will have very different impacts.
Right.
And if we're just planning for diversion that covers one, we're going to miss all the rest of it.
I think it's a question it's probably a good, there's probably research out there to know, does a tolling program cause freight diversion? My gut tells me that the commercial carriers who are trying to get goods from A to B, it's going to be way more important to them for speed rather than a few dollars. So I think we should ask the question, is freight diversion a concern? And if so, how would it be addressed?
Right.
My gut is telling me that it probably isn't a big impact, but I don't know.
Yeah. Well, and I think, Sharon, you're correct. I think that would make sense. But I think it's important to ask the question, because otherwise we make assumptions about what diversion means. And it may be more than what we think.
Okay, great. Amanda, and then we're going to move on to social resource maps and performance measures. Yeah, Amanda.
I like to be the one that closes out each of these sections.
Oh, it's great. Yeah.
I agree with what Phil and Bill and Sharon have just mentioned. I think we need to have a better, I don't know, definition or parameters around diversion and around impacts. And I'm just thinking about this freight question. And one thing that occurs to me is there's probably a range within freight, like big commercial freight, probably, yes, the cost of doing business is paying the toll because you can get there faster, but local, like I'm thinking Washington County, some of the agricultural business, you know, single mom and pop agricultural business that are shipping produce and plants, you know, throughout the metro area, that might be different because that's not, they don't operate on the same level. And so there's probably a lot to think about there that I certainly don't know, but I like the idea of diving into that a little more.
Okay, thank you. Okay, let's move on to our next question, which is on the performance measures. So this is the performance measures neighborhood health and safety document, and was the result of some of the discussions that the deep dive scuba team engaged in. And even I need to bring this up on my computer too. So, oh, look at Bill as being so helpful. He's the co-facilitator here. Thank you.
I just have to have them all queued up or else I'm going to forget as well.
Oh, I know. And I thought I had them all queued up on my second screen here, but no, I didn't. Okay, so there's a few maps in here showing, you know, with I-205 as the example of different social resources. And then there's also some information about the conversation that we heard a little bit about, and then the different performance measures. But our question is really building on the NEPA scuba team and the social resources maps, what is missing? And beyond putting the social resources on a map, how can we deepen our understanding of the community and the impact of tolling? Looks like we're getting some other comments from our other teams too.
I think an answer to that would be having sort of in-depth interviews with certain agencies, certain sections of the community, and understanding maybe not. See, I feel like it's potentially you're going to get lost in the weeds here, but everything is sort of interconnected. And so I go back to sort of the dialysis example. And so dialysis, I don't really think about tollings when I think about dialysis, but then you dig in deeper of how that trip is provided, who is providing that trip, where are the destinations to access dialysis versus the origin of the trip, and how is that all interrelated? And you see that tolling could have a big effect on that, depending on how the transportation is provided. So using that sort of model of thought, how would that equate to other things that I can't think of at the moment? But then again, I feel like you're getting in the weeds, but if you get in the weeds far enough, you'll see how everything's interconnected, sort of like that diagram we saw from San Francisco.
So just taking that up a notch, you know, just thinking about certain personas in order to really understand community impacts. And you picked out a great one, someone who has to go to dialysis 3 days a week.
Yeah, I guess maybe we could find someone who's like riding the bus from Oregon City into downtown Portland or something like that, and do like a tag along on their journey, and how would tolling affect that? Maybe it doesn't affect it at all, maybe it does. And that's why I feel sort of hesitant to bring it up, because it sounds like a lot of work for not having a guaranteed answer at the end.
I see.
The answer could be like, yeah, there's no impact, so thanks for spending the 80 hours researching it. So that's what concerns me. But
I wonder if, you know, my sense is that the NEPA process has a pretty robust community outreach and, you know, question. So we might get some of those answers. We might learn more as the process unfolds. And maybe the staff can tell me if I'm right about that or not.
But how do we ensure that we connect with the right people to learn that? So as I was digging into the dialysis question again, there's a lot of stuff that I had completely forgot about since I haven't looked into it for a while. And I got lucky. I have this video from Ride Connection that's about 15 minutes long, and it goes through everything that it takes for someone to travel there and back. So it's just very informative. And so, but I don't think those are created for everything that someone needs to get to. Like nursing homes, if they're taking, or retirement homes, and someone needs to use that vehicle to get to the medical appointment, and but say maybe they only offer on transportation on Tuesdays. Is Tuesdays affected somehow greater via tolling for those trips? And then you just hear stories about retirement communities saying they have transportation, and when you actually need it, it's not there.
You know, I think building on what Sharon said, you know, I think the community engagement piece is pretty critical in this area. I mean, there's no better way to understand a community than to go to the community. And, you know, so for example, we already have on the list, you know, community centers, which are hubs for community activity and community services. Well, I'm sure those folks have a pretty darn good idea of what's going on in the community and what the community is concerned about. And same thing if we went to, for example, FQHCs in communities, because those also act as very important social service centers where people come with various both social, physical, and mental problems. And great way to find out what's going on with those individuals, but also with the community at large.
I think we're going to be breaking a little bit soon, in a little soon. And what are FQHCs?
Oh, federally qualified health centers.
Okay, thanks. I've realized.
We have that defined in the slides.
Okay, good. Thanks. Sorry, I missed that one.
I wonder if we shouldn't include veterans centers in this list.
Yeah, absolutely.
Good one. So Chris, you're on, Chris Lepe, you're here. Do we need a member of the EMAC team to do the report out, or the small group facilitators, i.e. me, doing the report out? Do you recall?
I think Ann is great at this.
I'm gonna look.
Your guys' choice. I suggest, I recommend, actually I demand that the person that spoke the least speak up. No, but whatever you guys want, it's your choice.
Okay. Anything else on our social resource maps, or anything else that we've talked about today that we want to go back to? You know, we started out with the research, we were reflecting on the policy and strategies ideas. So, you know, this is the time, this is the brainstorming session. So, you know, related to neighborhood health and safety and diversion. Oh, and we're going to be leaving here very shortly. So in about a minute. So if anyone has, are we feeling good about where we are? Oh, there, you know, of course there will be other opportunities to weigh in. So this isn't your only opportunity. We'll look forward to any other follow-up conversations or epiphanies that you have tonight at 11.
I mean, I think we've covered. I think we've covered most of it.
Okay, that's great. I'm feeling like I was feeling pretty good about things. So that's awesome. All right. Well, soon in about 20 seconds, you will go back together. So thank you all for being in a breakout community with me today.